Hello, everyone. Good evening
Yes.
and welcome to today's webinar, Post-COVID-19 Back to Work Mental Health Fitness Test and How to Ensure Your Employees Are Mentally Fit Transition Back to Work from Working at Home. To all of you, thank you for taking your time out and being here today. Let me introduce our honorable speaker of this webinar, Dr. Edward Chan, a PhD holder in psychology and Master of Science in Learning and Master in Nutritional Medicine, Bachelor of Science Honors in Psychology and Postgraduate Diploma in Corporate Psychology. He is also the Principal Consultant at PsyCorp, a Center for Corporate Psychology, and board certified corporate therapist with the Malaysian Association of Psychotherapy and the International Society for Psychotherapy, Counseling and Psychiatry Fellow of the World Council for Psychotherapy. Apart from all this astounding educational and professional background, Dr. Edward is also an invited speaker for the ninth World Congress for Psychotherapy for the year of 2020, keynote speaker for the fourth International Psychotherapy, Counseling, Counseling and Psychiatry Conference 2020, and invited speaker for the 34th European Psychiatry Conference on Schema Therapy. Not to forgotten, Dr. Edward has done his remarkable contribution to the world through his writings, as he is also the author of several books entitled Dancing with Crocodile, Key Strategies of Corporate Psychology, and Love is Never Enough. Apart from that, multiple of his works have been published in the Journal of Cognitive Therapy and Research, Journal of Reattached Therapy and Developmental Directives, International Journal of Psychiatry, and he is also an accredited reattached therapist. Ladies and gentlemen, here to discuss more on COVID-19's impacts on employees' mental health, please welcome Dr. Edward Chan. Hello, doctor.
Hi, Kamini. Thank you for the kind introduction. Are you able to see me clearly and hear me
Yes,
clearly?
yes,
All
yes.
right. I'm in somewhere nice. Not sure how's the connection, but
Right, we still can see and hear you clearly.
fantastic.
Right, great to
Yes,
see you, doctor. How are you today?
I'm good. I'm good. Yes, taking time out from a meeting, but it's good.
Right.
Yes.
Right. Dear
Mm.
audience, we will be running a live Q&A session at the end of the webinar. So you may turn on your camera and ask a question directly to Doctor, or you can also write down your questions at the chat forum, which I will be reading out during the Q&A session. And if you miss anything, don't worry. These recordings will be available in IPC Facebook and YouTube channel. Doctor, over 52 million cases and 1.29 million confirmed fatalities so far, the ongoing COVID-19 pandemic has profoundly impacted all aspects of our life. From forced lockdown to social distancing and travel restriction, the pandemic can be considered a watershed moment in human history and not forgotten of those who contracted the disease or their loved one. This virus has changed our daily personal and professional life in an unprecedented manner. Can we hear from you? What are the mental health threats an employee could be facing from this crisis situation?
Yes, that is a very important. Um, I mean, the mental health is rising. The mental health issues is rising
Mm-hmm.
because of all these unprecedented changes everyone is facing, right? And we do know that with changes of any kind,
Mm-hmm.
stress would be resulted, and with stress, we are all getting vulnerable to having mental health diseases of all type. And the other thing that is of utmost importance for organizations of any kind is that stress is contagious,
Mm-hmm.
as contagious as COVID-19, in fact. right? So if you have some team members that come into work and they are stressed, depressed, and soon the whole team will be affected. The whole
Wow.
organizations would be vulnerable, which
Wow.
is why we need to ensure that all team members are absolutely psychologically fit before they get back, to join the team and get back to work.
Right. Does that means many of the employees might not be fit enough to deliver their optimum productivity at this moment yet?
You're right. You're right. If they are not ready,
Mm-hmm.
and they might not be ready because of this long break, over a year for most
Mm-hmm.
of us, from working from home, which have given rise to all sort of stress in its own term, because we are next to our family members, next to screaming children, all our routines are disrupted. We don't
Right.
exercise, sleep are disrupted. So we are subjected to all sort of stress, and now we are bringing all those into the workplace. So yes, that definitely many of us might not be ready,
I
might not be
see.
mentally fit,
Wow.
and as a result, we will for sure not be able to deliver our optimum productivity, not be able to serve, our
Mm-hmm.
customers in the most professional manner. Yeah, so all this
Right.
having big impact for everyone, and
Mm-hmm.
we need to ensure that our team members are being screened,
Mm-hmm.
so that if they are not ready,
Mm-hmm.
then they are given the necessary retraining,
Mm-hmm.
right,
Mm-hmm.
rehabilitation,
Mm-hmm.
before they allow back
Join the work.
to join the
Mm-hmm.
team members, to join the
Mm-hmm.
organizations.
Right. So when you say screening, is there any measurement or metric system we can
Yes,
access?
so the International Psychology Center
Mm-hmm.
has taken up this opportunity, this challenge,
Mm-hmm.
to help organizations and the employees, to offer this tool that we have developed. It is a validated, internationally validated tool, whereby the employees, through a set of standardized questions,
Mm-hmm.
will be able to review whether they are psychologically and mentally fit
Mm. Right.
to get back to work
Mm-hmm.
after,
Mm-hmm.
after a pandemic, after having worked from home,
Mm.
including those who have been tested positive for COVID and have recovered,
Mm-hmm.
as well as those, who are just working from home,
Mm-hmm.
because they have their own issues as well. We
Mm-hmm.
do have many clients,
Mm-hmm.
who from organizations who had COVID-19 positive, and now even though they have recovered, they're still not ready. They're still psychologically affected. They're still traumatized, by the whole
Right.
experience, even
Mm-hmm.
though they no longer have the disease,
Mm-hmm.
right?
Mm-hmm.
So that is something that we need to do to retrain and rehabilitate these people psychologically as well,
Right. Right.
as well as physically.
Right. So, International Psychology Center come up with this assessment called COVID-19 Back to Work Mental Health Fitness Test, right? In order to
That's
assess
right. Yes,
employees.
that's
Okay.
right. That's right. Yes.
Right. So,
Mm.
doctor, regarding this fitness test, who are eligible to take this assessment? Is it somebody who has been contracted with the virus before or any specific categories?
Yes, certainly those who have contracted the virus,
Mm-hmm.
they would be very much recommended to take this
Mm-hmm.
test. Even
Mm-hmm.
though they have physically recovered from the virus,
Mm-hmm.
we need to ensure that they're also mentally recover as well,
Right.
right? But as well as those who did not get the
Mm-hmm.
virus,
Mm-hmm.
right? But of course still having all sort of anxieties now, going back to work, increasing exposures, and the vaccine is not going to come, for most people
Right.
until much later.
Mm-hmm.
And even if you have the vaccine, it's not like guaranteed that you're not going to contract the
Mm-hmm.
virus, right?
Mm-hmm. Mm-hmm.
Um, so yes, the test would be for uh, most people
Right.
who wants to get back to work, from
Mm-hmm.
the workplace,
Mm-hmm. So, which means any
which
employees or employers who would want to get a clear
indeed,
insight on their mental health state can go for this. All
exactly,
right. Okay.
yes,
Can you brief
indeed,
a
indeed,
little
yeah.
more on what are the components of this assessment? Is it a specific personality test or a generalized cognitive test?
It has different components. All
Mm-hmm.
right. So one of the component, for example, would be what we call a psychological program called
Mm-hmm.
schema.
Mm-hmm.
Right.
Mm-hmm.
Um, so certain people are more vulnerable towards having this post COVID-19 anxiety
Mm-hmm.
and mental health issues
Mm-hmm.
because of certain psychological program or schema that I have, namely one that we call vulnerability to harm.
Right.
So these are people that grow up, during their childhood, um, being exposed
Mm-hmm.
to dangers, to anxiety.
Mm.
So one of the core childhood, we have many childhood needs, of course, right? And one
Mm-hmm.
of which is safety. We need to feel safe growing up,
Mm-hmm.
right? And many of us do not have that,
Mm-hmm.
right? For
Mm-hmm.
whatever reasons, and of course, this is not to necessarily blame our parents. I mean, they are, try their best. Many of them, they are busy people, but still, there are gaps, right? And somehow some of us got left, left alone, or left lost, in the shopping mall, or even abused, right?
Okay.
So then we grow up having this schema
Mm-hmm.
of feeling vulnerable, that the world is not a safe place, and because of
Right.
this program we carry with us,
Mm-hmm.
um, in our not necessarily consciously, many of us do that subconsciously,
Mm-hmm.
and with that, then we are more vulnerable to having this anxiety
Right.
when we come back to work, with all the uncertainties still going on.
Mm-hmm.
You see people everywhere with masks and everything. All these are triggering this vulnerability in many of us, right? And so if we didn't take extra measure to protect ourselves,
Mm-hmm.
then indeed this vulnerability become real. From a psychological vulnerability, it will affect our immune system, it affect our stress level, and indeed it make us more likely to then contract a physical
Mm-hmm.
disease like COVID.
Mm-hmm.
So so we would one of the assessment would indeed be assessing this schema vulnerability to
Right.
harm schema, and see whether the employee would have this,
Mm-hmm.
and if they are, then it would indeed contribute to their mental readiness to get back to work. So this is one, if you like, personality components,
Mm-hmm.
right?
Mm-hmm.
Is a what we call a developmental components. Yeah.
Mm-hmm.
But also we are assessing how we cope with stressors,
Oh.
right?
Mm-hmm.
We have different ways of coping with stressors. Some people, try to avoid, try to detach themselves. Some of
Mm-hmm.
us use,
Mm-hmm.
or sort of addiction, from
Mm-hmm.
drinking to
Mm-hmm.
shopping, to sex, pornography. So this is what we call a self-soothing um, coping mechanism, right?
Right.
Which are actually negative. Initially it sort of help us to cope, but in the long run it becomes more detrimental in the coping, like smoking. If we we when for smokers, we feel that when we smoke, it helps us decrease our stress. But
Mm-hmm.
then when we become addicted, we don't smoke, and then our stress level increase,
Right.
right? So these are negative coping methods. So we also assess that, to see how
Mm-hmm.
much we use positive or negative coping methods, and then we look at for stress level, anxiety level,
Mm-hmm.
depression levels,
Mm-hmm.
as well. The way that we protect ourselves, like do we sleep well, do we exercise
Mm-hmm.
well, do we have a good diet, so all these stress resilience that
Mm-hmm.
would help us to be mentally fit, or not.
Mm-hmm.
So we have all these different components in the test
Right,
to
right,
ensure that all everything is in place for us
right,
to be totally mentally fit
right,
to get back to work.
right. So
Mm.
this test
And
doesn't.
if the
Mhm.
and
Sorry, doctor, go
yeah,
on. Yeah.
and if there are any gaps, if
Mm-hmm.
there are any gaps, then it give rise in the result to a profile of what we call growth areas, areas of opportunities uh, for these team members to be trained, to
Mm-hmm.
increase their resilience. Yeah,
Mm-hmm.
so it has not only a diagnostic objective, but
Mm-hmm.
also an objective for training, for retraining. You know.
Mm-hmm. Mm-hmm. Right. So this fitness test doesn't only study on the impact of COVID-19, but it goes even beyond that to come up with this employee's personality profile. And can we understand more how does this benefit the employer-employee relationship?
Yes. The way that we want employer to make this available to the employee is
Mm-hmm.
is, is that it convey a message, to the employee, that the organization, the employer care about the
Right,
well-being of the
right.
employees, right? So
Mm-hmm.
we don't want it to be like you know something that the employer use to screen out employees and to penalize them. No, we want it to be a tool
Mm-hmm.
to be used for training, for growth, to help the employees and the organization. So this is
Mm-hmm.
the way that we hope the test is going to be used.
Right, right. So I believe when employees get this
Mm.
message, it will also positively impact the company's staff retention rate, correct?
Yes, that is
Right.
very important, because morale uh,
Mm-hmm.
is of the utmost important now. A good morale, and organizations are very vulnerable to having low morale with all this COVID pandemic going on, all this stress going on,
Mm-hmm.
right? So having a good morale is important, and if there are pressure and employees leave and organizations,
Mm-hmm.
then the whole organization, the whole team experience pressure, of overworking, of needing to find new team members, retraining, all these leading back to a negative loop, into the pressure on the team, and low morale. So this would be a good way to keep loyalty, and keep the team going, develop new skills to in this very challenging time.
Right.
Definitely.
Right. So I see this is also an opportunity for the corporate to implement this as their strategic leadership tool, right?
Yes, that definitely, and the leaders, managers that can take the lead and share the results, with their team members, in this tool. Yeah, that definitely. So that there would be transparency, on the results of everyone, and the whole team can see what are the areas of opportunities of growth, of strength, of skills and resources,
Right.
that the tool can review, for everyone. So the back to this topic of of a schema, which is one of the component of the tool, is we want to turn, from the some of this dysfunctional program or schema to a healthy functional schema, right? A healthy, what we call a healthy adult schema or program,
Right.
so that the person, the team member will be resilient to the stress, right? So if they meet any the challenges during the day, any stress, so they're able to navigate out from it, in a healthy function, rather than succumbing to those stressors, or choose negative coping methods that we mentioned to deal with the stressors. Yeah.
Right.
So we that's the purpose of that.
Right, doctor. So, doctor, how will the result or outcome of this report looks like? Is it like a green light whether they mentally fit to work or not?
Yeah, so you would have the different categories, from green, where they are totally ready, to yellow, where there are some concerns, areas of growth, all the way to red, where there are several areas,
I see.
multiple areas to work on, of growth areas, we call them,
I
right?
see. And
Yeah.
for those employees who deems to fail to be mentally fit, what's next? Will they lose their job or something?
Well, exactly. So this is where we want the tool to be used in a positive manner, right? For training purpose, not to penalize and punish employees, to kick them out or anything like that. This would, I think, will be highly illegal to start with. I don't think you can use any psychometric tools to dismiss employees, right?
Right.
So that is a HR legal issue, which I don't think is possible. But certainly it can be used in conjunction with policies, HR policies of retraining, of developments. So it is to use for that purpose. But of course, you can you use it for selection as well, right? If you have wanting to have recruitment and addition, expansion, the tool can be used to see whether uh, the applicants has the necessary resources, psychological resources
Yeah.
to
Also, as a
mm,
promotion criteria.
yeah, indeed, yes,
Right.
as a promotion criteria, very,
Mm,
very much so. Yeah.
right. So, let's say those
So they are,
employees. Mhm.
yeah.
Sorry, doctor, you go on.
Yes. No,
Okay.
I was just saying, to
Mhm.
you to reiterate your point that there are therefore these multiple objectives that
Right.
the tool can be used, right, for
Right.
retraining,
So, mhm.
promotion. Yeah. Mm.
And for let's say the staff is like not so mentally fit, I believe International Psychology Center will continue the journey by providing more assistance in form of psychotherapy or something.
Yes,
Mm,
indeed.
mm-hmm.
In terms of corporate training, we
Ah,
we definitely can assist. You using a tool as a pre-training and post-training guide, right?
uh-huh.
Um, yeah, so the tool can be used uh, to do that. So one of the problem with corporate training is that it is not easy to evaluate what and in organizations the corporate world like to to have the ROI, return on investments.
Yes,
So with a lot of training, it's not easy to
right,
see what are the ROIs, right? But with
right,
this tool, you can actually use it to monitor and see the effectiveness of the training. Of course, you can't hope to change the score within a couple of days of training. I mean, the training we are talking about, takes over several months, right? So we
uh-huh.
have some intensive training, but then we have follow-ups, on the field, uh,
Mm-hmm.
coaching, right?
Mm-hmm.
So this is the sort of medium term training
Mm-hmm.
that we are talking about. Um,
Mm-hmm.
we teach the skills, the mental skills, the psychological skills, but then the employee would given the opportunity to apply these skills in the workplace or at home, and then followed up by the corporate psychologists, to see how they are able to apply the new skills, and how they're able to practice these new skills, which will then eventually change the scores, in the test, in the results,
Mm-hmm.
that it will change their program, their schema from vulnerability to harm to a functional, productive schema,
Right.
to increase the resilience
Mm-hmm.
to stress, changing their negative stress coping skills to
Mm.
positive stress
Mm-hmm.
coping skills. So all these are multiple areas that
Right.
the training will be able to change as will be um, captured in the results of this test.
Mm-hmm, mm-hmm. So when we talk about these skills, the stress handling skills, I believe it goes even more further, which will also impact an employee's analytical skills, decision making skills, right?
Yes, very much so. Very
Mm-hmm,
much so.
mm-hmm.
Yes.
Right. So these trainings will be given to the employees in order to make them to be more fit to join the work, right? Which is also will be incorporated with
Yes.
some
Yes.
lifestyle modification strategies on diet, sleep, and on all those stuff.
Yes. Yes. This will be part of the lifestyle, stress
Mm-hmm.
resilient skills, right? Yeah. In
Right.
conjunction with the psychological skills,
Mm-hmm,
very
mm-hmm.
much so.
Nice, nice,
Yeah.
doctor. So let's talk the benefit from the employer's view to engage with such mental fitness tests. If let's say there's some employers
Hmm.
who choose to close their eyes and ignore the mental health issues or suffering of their employees, what's the impact they might be subjected to?
Well, well, stress being contagious, like we
Mm-hmm.
mentioned,
Mm-hmm.
it would affect the whole team, right?
Mm-hmm.
And not only in terms of MCs, absenteeism, um, but
Right.
also the presentism, that the employee will actually be present, but physically present, but not mentally
Mm-hmm.
present. They'll be preoccupied with anxieties, with worried, with issues at home, with personal issues, you know,
Mm-hmm.
um, and of course, it would also um, affect the health as well,
Mm-hmm.
the sleep levels, and they're down all the way to their productivity, right?
Mm-hmm.
Productivity not in only in terms
Right.
of quantity, but also of quality,
Yes. Yes.
how professional they are, whether they're treating the customers as in a very professional mode, treating them as another product, and
Mm-hmm.
another number on the on the line, right? So
Right.
all these yeah, will be very much affected, and of course the loyalty to the
Yes.
organization would be very much affected as
Right.
well,
Right.
right? The morale,
Interesting.
yeah,
Right.
yeah.
So let's
Mm.
attend to some Q&A session. Audience, you may switch on your camera and ask questions with Doctor directly if you have any. Right. Meanwhile, Doctor, is there anything that you would like to add on that I might have forgotten to ask you regarding this fitness test?
Um, well, I think this is the first time,
Mm-hmm.
and it's a very necessary time for such a test, to come out, because um, we haven't, uh, the whole world face a lockdown to this
Yes.
scale,
Yes.
for a very long time, not since the Spanish flu, right? So so really the whole population, the whole world is being affected psychologically, right?
Right.
And the whole landscape of work has changed. The whole landscape of the world economy, the workplace have changed. So we need a tool, right,
Mm-hmm.
to measure the readiness and gap,
Mm-hmm.
for the workforce, which is why we have come up with this tool. And the other thing is that the two come hand in hand with something called Employee Assistance Program, EAP, which
Right.
was an initiative pioneer in the United States initially,
Mm-hmm.
uh, to screen, again screening, right? Employee with substance abuse problem, yeah, with
Right.
addiction problem. That was how EAP was first brought about to the workplace,
Mm-hmm.
in the US, and now it has the whole program has become a tool for organizations, and IPC is one of the pioneers this EAP to the
Mm-hmm.
workforce organization,
Mm-hmm.
and then we have play a role in setting up the Employee Assistance Professionals Association of Malaysia, EAPPA. Um, and over the years, we have helped many organizations, from Bank Negara to Accenture,
Oh,
many multinational companies to use this tool to provide counseling counseling, training, wellness coaching. Um, so the whole idea is you give a tool to organizations that is very proactive, right? That you don't wait until many organizations they won't know until they get a resignation letter, from the
Yes.
key employee, right? Until it's too late that they don't even realize that the employee has been very stressed, having burnout and very dissatisfied with with things. So the EAP is providing a tool, whereby the EAP provider, which is normally a third party supplier like IPC, International Psychology Center, rather than being supplied internally by the organization, because otherwise research shows that employee would not trust an EAP that is internally supplied, so it has to be outsourced by a professional third party, like the International Psychology Center. So the COVID-19, back to work mental health fitness test is used very much in conjunction with a EAP program that the IPC has. So in all our EAP program, we roll out these tools to help organizations to ensure that to plot a journey, a resilience wellness journey for the employee. So this is not like going to your GP, for your cough and cold and checkup, but it is a year-long, multi-years journey that we are plotting, to grow with the teams and the organization. So we use the tool to plot the growth, the achievements, the skills building that has been highlighted and be used by the coachee and the counselors to work with team members in the organization. So that would be a point I would like to highlight as well.
Right.
That
This is so impressive.
the tool is the test is only one component of a wellness program that IPC has to work with organizations.
Right. If let's say there's any employees is interested to implement this EAP program or wellness program in their company, how do they go about it?
Yeah, they can contact the corporate psychology division of IPC, called Psychop, right? Yeah, Psychop, it is in our website, which is www.counseling.com.my, and you will see the corporate psychology division, Psychop, and our details are there. We are in the LinkedIn, in Facebook, we have a blog, and we have regular webinars, we have newsletters, regularly. These are all given for free on our websites and our blogs as well. Yeah.
Right. Very interesting. You're doing a very great job in changing.
Well, we just want to play our role to help our country, to help the world economy, in this very challenging time. Indeed.
Right. According to recent research, almost 42% of global employees have experienced a decline in mental health.
Yes.
Since the pandemic began, right?
Indeed. I mean, the lockdown has enormous, mental mental health outcome, right? We know that it is maybe necessary, to have the lockdown, but at the same time, the mental health repercussions
Right.
has been enormous, all the way to depression, suicide, and and I must say, not only to the workforce, but
Mhm.
also to to the school children, to
Mm.
youngsters, teenagers, to the whole population, which then of course would affect back the work population, because
Mhm.
these are family members, who have children, who have spouses, who have elderly parents, so everything is impacted and
True.
interrelated and affected, right?
Right.
Yeah.
It's sad
So
actually. Yeah.
yeah, but at the same time, it is something that we can do something about,
Mm.
and hopefully we can take this as a lesson, so that when the next and there will be, I'm sure
Mm.
many more
Oh.
pandemics that will going to come, that we are more ready for them, right?
Mhm. Mhm.
Um, yeah. So
Right. And we all know supervising employees are hard enough on normal days, and it's not going to be any better during such difficult time. And employers around the world are already facing issues of how to safely welcome their employee back to office after, like you said, almost a year where all employees have been working from home. I would
mm,
say this is a major challenge for employers because,
well, and
yeah.
I mean, talking about that point, it
Mhm.
is very important for leaders, themselves, for managers, for supervisors, to be aware of all these mental health issues, all this mental health stress. So they can be on the lookout, they can recognize the symptoms, the signs, and how to support the entire team. So it is very important for leaders to take the lead,
Right.
in this initiative, really, and to hopefully do the test themselves, and share the
Right.
results. Yeah.
I think we all have to agree that a COVID-19 pandemic requiring all organization to change and significantly adjust their operation and strategies to prioritize human wellness. We're already at that stage right now.
Yes, indeed. Yeah,
And
and wellness, of physical and mental health wellness are intimately linked. We have to realize that we cannot separate. When you are, when physically unwell, it would affect you mentally. When you're
mhm,
mentally unwell, emotionally unwell, it will affect your productivity. It will affect you physically as well.
right.
So they're both part, different side of the same coin. You know.
Right, right.
Mm.
Thankfully, we have such life-saving solution from International Psychology Center like mental health, fitness tests, and employee
Yes.
assistance program that can guide us all along
Mm.
to make a significant changes in employees, both productivity and welfare, right? So I think
Yes.
this can
Yes.
be a
Mm.
huge game changer for corporates out there.
Indeed. Indeed. And also the protective mechanism building, too, as well. To prevent, um, mental uh, diseases, mental and even physical diseases, right? To be more
Right,
resilient. So that is,
right, right. We are
and
nearing.
to
Mhm.
prevent, yeah, and to prevent the negative coping methods, the
Right.
use of negative coping methods, which can lead to detriment of the
Mm-hmm.
mental health and physical health of
Mm-hmm.
teams.
Really, yes. I can really clearly see how this test and welfare system can add value to every employee's life, actually. Yeah,
Mm, yes,
right.
very true.
We are nearing the end session, and Dr. Edward, thank you so much for coming up with such solution, and also huge thanks for all your sharing today.
You're most welcome. And we hope that more people will get the knowledge, will get the skills, of these important tools that you know I and our team in IPC have been privileged to being able to use from many of our pretty you know predecessors, people who come before us, who other psychologists and other leaders. So we are just lucky to be able to leverage on some of this existing knowledge that is already out there. Yeah. So
Right,
and we hope to play our part, to turn our country around, you know
right.
our
This is indeed very
workforce
remarkable.
around.
Yes.
Wow, and thank you for the having this conversation, important conversation today, so that this knowledge can be spread out there for more people to know what we are doing, you know, and you yourself have been embarking on a journey, to learn about therapy and counseling. That's
Right.
fantastic to help others.
Thank you for
Yeah.
inspiring us to do this.
Yeah. Well, uh, you know, the good we do comes around.
Right. Dear audience, thank you so much for all your time. And Doctor, thank you again. And we'll meet on the next webinar again.
Sure. Yeah. Have a nice day.
Thank
Yeah.
you, Doctor. Have a good day, everyone. Bye bye.
All right. Bye bye.